Good evening to you. Our top stories tonight. The Supreme Court has been in session since 2 p.m. this afternoon in relation to the disappearance of the $50 million from the UAE. 5 of the 6 suspects arrested in this case last month had to be present in court today. Chief Justice Ronnie Govinden, who is presiding over the case, will give his decision later this evening on whether to remand 4 suspects who are in custody and whether to maintain the conditions of the 5th suspect, who was released on bail last month. The Anti-Corruption Commission, the ACCS, has asked the court to remand the 4 suspects in custody. 8 participants with disabilities received their certificates after completing a reskilling program of 6 months. The program, the first of its kind, aims to reskill people with disabilities to facilitate their placement in the job market. The participants were all awarded with a certificate and a shield displaying their outstanding performances in life and budgeting skills, housekeeping, computer and administrative skills, office management, photography, food production and languages. The best overall performer for cohort 2021 was Ibrahim Dodin. The ceremony was attended by the First Lady Linda Ramkalawan, Minister Patricia Franco, amongst other invitees. The Ministry of Health has received 5 more wheelchairs from the Grand Case Casino. This was during a short ceremony at the Seychelles Hospital this afternoon to coincide with the International Day of the Disabled. It was Shama Amsbury, the PR and Communications Manager of Grand Case, who presented the wheelchairs to the Deputy CEO of the healthcare agency, Kathleen Cécile. The wheelchairs, the second such donation by Grand Case, were bought locally. Mrs. Cecil said that the donation will benefit the rehabilitation services of the occupational therapy unit, especially for physiotherapy purposes. She has also commended the great public-private partnership.
Although the tax itself is not obligatory anymore, Grand Case still insists in a way, on continuing to keep this initiative going. We feel, if anything, NGOs are now even more in need of help. And the same goes for the hospital. With COVID having taken such a big toll and precedence, we just want to assist with other little things that may have become overlooked or may have had to be put on the back burner, no matter how essential they are.
We understand that your line of business has been affected to a very large extent by the COVID-19 pandemic in the country. Our line of business has also been affected by the COVID pandemic in the country, where indeed some much needed essential items have been overlooked. Because we have had to focus on preventing further aggravation of the effect of the pandemic, the rate of infections in the country, and that has made a large impact on our budget, on our financial resources, and also on our human resources, I must add. And we greatly recognize the sacrifice that you are doing by making a donation to us, and we thank you for having donated earlier during the year to the COVID-19 Relief Fund. That relief fund has supported us in many, many ways very extensively.
The National Assembly has endorsed the spending of 1.3 billion rupees for the Ministry of Education in the Appropriation Bill for 2022. In his presentation prior to the MNA's intervention on this budget, Minister Justin Valentin explained the general merit of the ministry's budgetary request, which he said reflects his plan for 2022. The National Assembly is at the moment examining the 2020 budget requirement for the Ministry of Local Government and Community Affairs for a sum of 138.4 million rupees. The National AIDS Council officially launched its activities for World AIDS Day with a ceremony at the Eden Bleu Hotel. At the ceremony, Reginald Waro, the first person to come forward publicly to say that he had been affected by AIDS and to share his experiences. Mr. Waro, who discovered he was infected at the age of 19, noted that he always took his treatment well and has remained strong until today. Singer Sonny D, for his part, sang about AIDS in support of those living with HIV. HASSO President Justin Frémineau said the organization has worked hard since the onset of the disease in Seychelles in terms of education and access to medicines. The chairperson of the National AIDS Council Board, Dr. Agnès Chetzi, said that inequalities are the biggest threat to successful treatment of HIV/AIDS.
Fortunate that we live in a country where prevention, treatment, and care services are available free of charge. But even in this seemingly ideal environment, inequalities can and sometimes do fester. We hear stories. However, we do not analyze our data enough to understand equity gaps, to clearly see which population groups or individuals have unmet needs or are being left behind. We need to change this.
From April next year, courier agents will be obliged to do the clearance procedures of courier mail on behalf of their clients, regardless of whether the goods exceed the 3,000 rupees personal allowance. This is to provide the door-to-door service mandated through their licenses. The procedures will also be done digitally instead of manually like it is being done today. The Principal Secretary for Trade, Celia Mangro, says that the change in procedures will improve the courier service, making it efficient, simpler and faster. There will also be a dedicated unit within Customs soon for courier clearance. It was the Cabinet of Ministers which approved these amendments during their sitting on the 24th of November.
At the moment, we have plans. As soon as you go over the 3,000 rupee personal limit, the client are the ones that has to go to the customs offices to do all the processes. Even if it's not above 3,000, but there are issues that customs have identified, they still have to go themselves. But with this new process, the courier agent will be the one doing it on behalf of the clients. So we expect this to take effect in April 2022, depending on everything being in order, because we do have consultants working on building the software. And we've already having meetings with the courier agents. They are meeting with customs and the consultants on a weekly or monthly basis, depending on what the issues are. And we are making sure that the system that we are building can read the system that they have, so that we can link everything.
Those are our main stories for this evening. Bye for now.